Fertility preservation. Options for patients undergoing gonadotoxic treatments, e.g., cancer patients. Fertility preservation refers to the medical methods used to help individuals who are undergoing treatments that could affect their fertility, such as chemotherapy, radiation therapy, or surgery. These treatments, especially those that are gonadotoxic, harmful to reproductive organs, can damage eggs, sperm, and reproductive tissues, leading to infertility. Fertility preservation offers these patients options to store reproductive material, eggs, sperm, embryos, or ovarian tissue for future use. 1. Importance of fertility preservation for cancer patients. Cancer treatments such as chemotherapy and radiation are known to have detrimental effects on the reproductive system. For women, chemotherapy can cause ovarian failure, premature menopause, or damage to the eggs, oocytes, while for men, chemotherapy and radiation can decrease sperm count, motility, and viability. The risk of fertility loss depends on several factors, including the type and dose of treatment, the patient's age, and the stage of their reproductive health at the time of treatment. Since many cancer treatments are required before patients reach reproductive age or complete the desired family size, fertility preservation provides the opportunity to safeguard reproductive function and provide hope for future family building. 2. Fertility preservation options for women. There are several methods available for fertility preservation in women which aim to preserve eggs, embryos, or ovarian tissue before undergoing gonadotoxic treatments. A. Egg cryopreservation, oocyte freezing. Process. Egg retrieval involves ovarian stimulation using gonadotropins, e.g. FSH, LH, to produce multiple eggs, followed by egg aspiration. The eggs are then frozen for future use. Indications. This method is suitable for women who have time to undergo ovarian stimulation before starting cancer treatment. Typically requires 10 to 14 days of stimulation. Success rate. Success depends on the patient's age at the time of egg retrieval. The younger the woman, the higher the chances of a successful pregnancy using thawed eggs. Limitations. Requires the patient to undergo hormonal stimulation and egg retrieval, which may not be possible for pupubescent girls or women who cannot delay cancer treatment. B. Embryo cryopreservation. Process involves the same initial steps as egg cryopreservation, but after the eggs are retrieved, they are fertilized with sperm from a partner or donor. The resulting embryos are then cryopreserved. Indications. Suitable for women who are in a committed relationship or those who have sperm available from a partner or sperm donor. Success rate. Typically higher success rates compared to egg freezing, as embryos have a higher survival rate after thawing. Limitations. Requires a male partner sperm or sperm donor, which may not be ideal for all women. Additionally, it requires time for fertilization and embryo development, which could delay cancer treatment. C. Ovarian tissue cryopreservation. Process. Ovarian tissue is surgically removed from the ovaries, frozen, and stored for future use. This technique preserves both the ovarian follicles and surrounding tissues that can be reimplanted after cancer treatment or used for IVF. Indications. This option is typically used for prepubescent girls who have not yet undergone puberty, or women who need immediate cancer treatment and cannot wait for egg or embryo retrieval. Success rate. This technique is still experimental, and while the success rates are improving, it is not as widely established as egg or embryo freezing. Limitations. The procedure involves surgery to remove ovarian tissue and carries risks associated with the reimplantation of the tissue. This is a relatively newer technique and is available in limited medical centers. D. Ovarian suppression with GnRH agonists. Process. The use of GnRH agonists, for example leuprorelin, during chemotherapy helps to temporarily suppress ovarian function and protect eggs from the damaging effects of chemotherapy. Indications. This is often used for women who cannot undergo egg or embryo freezing, such as those with limited time before starting cancer treatment. Success rate. It is still being studied for its effectiveness. It may offer some protection, but it does not guarantee the preservation of fertility. Limitations. This method may not fully prevent ovarian damage, and it is generally used as an adjunct to other fertility preservation methods. 3. Fertility preservation options for men. For men undergoing cancer treatment, sperm cryopreservation is the most common and established fertility preservation method. A. Sperm cryopreservation, sperm banking. Process. Sperm is collected and frozen in liquid nitrogen for future use. The sperm is typically washed and cryoprotectants are added before freezing to ensure cell survival after thawing. Indications. This is the standard fertility preservation method for men with normal sperm production who have time to collect and freeze sperm before starting cancer treatments. Success rate. Sperm cryopreservation has a high success rate, with sperm often surviving the freezing and thawing process. It is commonly used in IVF or IUI procedures. Limitations. It requires the patient to be able to provide a sperm sample, which may not be possible for boys who have not reached puberty. B. Testicular sperm extraction, TESE. Process. For men who cannot produce sperm in their ejaculate, e.g. due to azoospermia or blockage, sperm can be retrieved directly from the testicles using surgical techniques like TESE, testicular sperm extraction, or MESA, microsurgical epididymal sperm aspiration. Indications. This is used when sperm banking is not possible due to absence of sperm in the ejaculate, or when a man has undergone a vasectomy or has an obstructed duct. Success rate. Sperm can be extracted from the testes and used in IVF with ICSI, intracytoplasmic sperm injection. The success rate depends on the quality and quantity of the retrieved sperm. Limitations. This method is invasive and can be costly. It also carries risks such as infection or damage to the testes. 4. Fertility preservation for children and adolescents. For prepubertal children, options are more limited, but advancements have made fertility preservation more feasible. A. Ovarian tissue cryopreservation for girls. Ovarian tissue cryopreservation can be used for young girls who have not yet reached puberty and therefore cannot undergo egg retrieval. The tissue is frozen and may later be reimplanted or used in IVF, though the technique is still being refined. B. Sperm banking for boys. For adolescent boys who have reached puberty, sperm banking is the most common method, and it is generally a safe and effective way to preserve fertility for future use. 5. Ethical considerations in fertility preservation. Informed consent. Patients must understand the risks, benefits, and costs of fertility preservation, especially when dealing with minors or those with cognitive impairments. Access and equity. Fertility preservation options can be expensive, and there are concerns about equitable access for all cancer patients. Emotional and psychological impact. The process of preserving fertility, especially in cancer patients, can cause emotional distress and the need for psychological support. 6. Conclusion. Fertility preservation provides cancer patients with the possibility of having biological children in the future, even after undergoing gonadotoxic treatments that can impair reproductive function. The success of these procedures largely depends on the patient's age, the method used, and the timing of treatment. Advances in cryopreservation techniques, such as egg, sperm, and embryo freezing, as well as newer methods like ovarian tissue cryopreservation, have greatly expanded the options for fertility preservation in cancer patients. However, ethical considerations and the cost of these procedures remain important factors to address. Summary of fertility preservation methods. Method. For whom. Indications. Success rate. Egg cryopreservation. Women of reproductive age. Cancer treatment. Ovarian damage. High success, especially for younger women. Embryo cryopreservation. Women with a partner. IVF cancer treatment. High success, especially in younger women. Ovarian tissue cryopreservation. Prepubertal girls, women with time constraints. Immediate cancer treatment. Still experimental, limited success. Sperm cryopreservation. Men of reproductive age. Cancer treatment. Infertility. High success, especially for young men. Testicular sperm extraction, TESE. Men with azoospermia. Obstructed ducts cancer treatment. Lower success compared to sperm banking. Ovarian suppression with GnRH agonists. Women undergoing chemotherapy to protect ovaries during chemotherapy. Still under investigation. Fertility preservation offers hope to many cancer patients, allowing them to plan for future family building even after treatment for cancer.